15 silent cancers that few doctors know about. Have you heard about the cancers that silently hide in our bodies? They show no obvious signs, are often mistaken for less serious conditions, and when discovered may already be at an advanced stage. But why does this happen? Is there anything we can do to identify them before it's too late? Imagine the difference that knowledge about these cancers could make in your life or the life of someone you love. Today, let's explore together the 15 quietest cancers that almost no one talks about. Understanding how they act, why they are so difficult to detect, and what signs we should look out for could be the first step towards saving lives. Get ready to discover information that could change the way you see your health. Let's get started. 1. Ovarian cancer, the villain that imitates common symptoms. Ovarian cancer is known as one of the most difficult to detect early. This is because its symptoms often mimic common conditions, such as abdominal discomfort, bloating, or changes in bowel habits. Unfortunately, these subtle signs are often ignored or attributed to everyday problems, such as poor diet or stress. Furthermore, there is no widely used and effective screening test for ovarian cancer, which makes early identification even more difficult. Studies show that in many cases, it is only diagnosed in advanced stages, when treatment is more challenging. Symptoms that deserve attention include an enlarged abdomen, persistent pelvic pain, a feeling of quick satiety when eating, and urinary changes. If you notice any of these signs persistently, it is essential to seek medical advice. Maintaining regular appointments with your gynecologist and reporting any changes in your body can be crucial. Awareness about this silent cancer could be the difference between life and death. And now, let's move on to the next cancer that can also fool even the most trained eyes. 2. Pancreas cancer, the silent killer nobody expects. Pancreatic cancer is often called the silent killer because of its ability to develop without showing overt symptoms. When it finally manifests, it is often already at an advanced stage, complicating the chances of successful treatment. The first signs of this cancer can be so subtle that they go unnoticed even by healthcare professionals. These include mild abdominal pain, unexplained weight loss, jaundice, yellowing of the skin and eyes, and changes in digestion, such as greasy stools or difficulty digesting certain foods. Additionally, it may be associated with new-onset diabetes or unexplained changes in blood glucose levels. Risk factors include family history, smoking, obesity, and chronic inflammation of the pancreas. Therefore, paying attention to small signs and carrying out imaging tests, such as ultrasounds and tomography, can be essential for an early diagnosis. Don't underestimate persistent discomfort or sudden changes in your body. And speaking of silent dangers, our next topic reveals a cancer that can stay hidden for years. 3. Kidney cancer, a problem that can stay hidden for years. Kidney cancer is a classic example of a disease that can progress slowly, often without causing symptoms in the early stages. This characteristic makes its early detection a challenge, leading to late diagnoses in many cases. When symptoms appear, they may include persistent lower back pain, blood in the urine, and feeling extremely tired. However, these signs are often confused with less serious kidney problems or muscle conditions. Kidney cancer is usually identified incidentally during imaging tests performed for other reasons, such as ultrasounds or tomography scans. This reinforces the importance of having regular checkups and being aware of changes in the body, even if they seem minimal. The main risk factors include smoking, obesity, hypertension, and family history of the disease. Maintaining a healthy lifestyle and reducing exposure to these factors can help reduce the chances of developing cancer. Being alert is crucial, as when detected early, treatment success rates are significantly higher. And if you think this is already worrying, the next cancer on our list brings even more diagnostic challenges. 4. Liver cancer, the champion in going unnoticed. Liver cancer is another example of a disease that develops silently, often without presenting clear symptoms until it reaches more advanced stages. Therefore, it is considered one of the most difficult cancers to identify early. When signs do appear, they may include extreme tiredness, unexplained weight loss, pain in the upper abdomen, and jaundice, characterized by yellowing of the skin and eyes. These symptoms, however, can be confused with other, less serious liver conditions. People with risk factors, such as chronic hepatitis B or C virus infection, excessive alcohol consumption, or pre-existing liver disease, are more vulnerable to liver cancer. Therefore, maintaining regular medical monitoring is essential, especially for those who fall into these risk groups. Imaging tests, such as ultrasound and MRI, can help identify changes in the liver before the situation worsens. In addition, blood tests, such as the alpha-fetoprotein tumor marker, can also provide valuable clues. Knowledge about this cancer is a powerful weapon for prevention and early diagnosis. And now, let's talk about a cancer that hides its intentions in the digestive system, confusing even experts. 5. Stomach cancer, the great deceit of the digestive system. Stomach cancer is one of the most challenging to diagnose in the early stages due to its ability to mimic common gastric conditions such as gastritis or reflux. This characteristic allows it to progress silently, making early diagnosis a real race against time. In the early stages, symptoms include a burning sensation in the stomach, loss of appetite, heartburn, and mild abdominal discomfort. However, as the disease progresses, more serious signs may emerge, such as persistent nausea, bloody vomiting, and significant weight loss. Infection with the bacteria. Helicobacter pylori is one of the main risk factors for developing this type of cancer, as is excessive consumption of foods rich in preservatives, smoked or very salty. Family history and smoking also play a role. The best way to detect stomach cancer early is through tests such as upper endoscopy, especially in people who have risk factors. Dietary changes and management of pre-existing gastric conditions can help reduce the chances of developing the disease. Paying attention to your body and not ignoring persistent symptoms is essential. And while this is already a cause for warning, the next cancer teaches us that even small glands can hide great dangers. 6. Thyroid cancer, when the gland doesn't give an alarm. Thyroid cancer is a disease that often goes unnoticed due to its slow progression and the absence of symptoms in the early stages. As it is a small gland located in the neck, its changes can be difficult to identify without specific tests. The most common signs include the appearance of a lump in the neck, changes in voice, difficulty swallowing or breathing, and a feeling of tightness in the cervical region. However, these symptoms usually only appear in more advanced stages, which makes early diagnosis difficult. Risk factors include radiation exposure, family history of thyroid disease, and certain genetic conditions. Women are also more likely to develop this type of cancer compared to men. Tracking is usually done through imaging tests, such as an ultrasound of the neck, and laboratory analyses that assess hormonal levels. The good news is that when detected early, thyroid cancer has high cure rates, especially if it is treated correctly with surgery and, in some cases, radioactive iodine therapy. Being aware of changes in the neck region and having regular checkups are important steps to ensure your health. And now let's discover the dangers that can lurk in another crucial system of the female body. 7. Endometrial cancer, the hidden danger in the female body. Endometrial cancer, which affects the inner lining of the uterus, is one of the most common gynecological cancers, but is often underestimated by many women. Despite presenting early signs in some cases, it can still go unnoticed, especially in postmenopausal women. The most characteristic symptom is abnormal uterine bleeding, which occurs outside the menstrual period or after menopause. Other signs include pelvic pain, unusual vaginal discharge, and in more advanced stages, unexplained weight loss. Risk factors include obesity, prolonged exposure to estrogen unopposed by progesterone, family history of endometrial cancer, and conditions such as polycystic ovary syndrome. Women with diabetes or hypertension are also more vulnerable. Early diagnosis is usually made through transvaginal ultrasound and, in suspected cases, endometrial biopsies. Maintaining regular gynecological monitoring is essential, especially for women with a history or relevant risk factors. Endometrial cancer is treatable in its early stages, and early detection is the best weapon to combat the disease. And while we explore gynecological challenges, it's time to address a cancer that is often overlooked among men. 8. Testis cancer, the secret that men don't understand. Testicular cancer is one of the most silent cancers among men, especially because its initial symptoms are usually almost imperceptible. Even though it is more common in young adults, many men do not know how to recognize the signs or ignore important changes. Early symptoms include the appearance of a painless lump in one of the testicles, a feeling of heaviness in the scrotum, or an abnormal increase in the size of the affected testicle. In some cases, there may be vague discomfort or pain in the abdominal or lower back region. Risk factors include a family history of testicular cancer, a history of cryptorchidism, undescended testicle, and previous testicular infections. As it is a relatively fast-growing cancer, early diagnosis is essential to increase the chances of a cure. The best form of prevention is to perform a monthly testicular self-examination, which allows changes to be identified early on. When noticing any change, it is important to seek medical advice and perform tests such as testicular ultrasound or blood tumor markers. Testicular cancer has high cure rates when detected early, making awareness about the disease a powerful tool. Now, let's talk about a cancer that can hide its dangers in one of the most fundamental parts of the digestive system. 9. Colorectal cancer. Signs that may pass as something simple. Colorectal cancer is one of the leading causes of cancer deaths worldwide, but its early diagnosis remains a challenge due to the subtle symptoms it presents in the early stages. Early signs may include changes in bowel habits, such as persistent diarrhea or constipation, a feeling of incomplete evacuation, blood in the stool, or a change in the shape of the stool. These manifestations are often confused with common gastrointestinal problems, delaying the search for medical help. Risk factors include a family history of colorectal cancer, diets high in animal fat and low in fiber, obesity, smoking, and a sedentary lifestyle. People over the age of 50 or with inflammatory bowel diseases such as ulcerative colitis are also more vulnerable. Colonoscopy is the most effective test for identifying early lesions in the colon and rectum, allowing polyps to be removed before they turn into cancer. Furthermore, fecal occult blood tests can be used as a complementary screening method. Maintaining a balanced diet, rich in fruits, vegetables, and fiber, as well as avoiding excessive consumption of alcohol and processed meats, can help prevent this disease. Pay attention to your body, as identifying changes in time can save lives. And if we talk about silent threats, the next cancer brings a special warning, as it affects even those who have never smoked. 10. Lung cancer. In non-smokers, the invisible danger. Lung cancer is widely associated with smoking, but what few know is that it can also affect people who have never smoked. This fact makes it even more dangerous, as it is often diagnosed late in non-smokers who do not consider the possibility of the disease. The first symptoms may be subtle, such as a persistent cough, shortness of breath, unexplained tiredness, or chest pain. In some cases, there is the presence of blood in the sputum, hoarseness, or recurrent lung infections, but these signs usually appear when the disease is already in an advanced stage. Exposure to secondhand smoke, air pollution, radon, a radioactive gas present in some homes, and certain genetic mutations are risk factors that can trigger lung cancer in non-smokers. Imaging tests, such as X-rays and computed tomography scans, are essential to identify lung nodules. Additionally, biopsies and genetic analysis can help confirm the diagnosis and direct treatment. Even without smoking, it is essential to adopt preventive practices, such as avoiding environments with cigarette smoke, reducing exposure to pollutants, and carrying out regular checkups. Now that you know more about this invisible cancer, let's explore another silent threat, especially worrying for men: 11. Prostate cancer, the adversary that acts in silence. Prostate cancer is one of the most common cancers among men, but its silent evolution makes it a threat that often goes unnoticed until it reaches advanced stages. Many men do not experience initial symptoms, and when they do appear, they may include difficulty urinating, a feeling that the bladder is not emptying completely, and pain when urinating. Another important sign is the presence of blood in urine or semen, but in many cases these symptoms can be attributed to other conditions, such as benign prostatic hyperplasia. The risk increases with age, especially after the age of 50, as well as in men with a family history of prostate cancer and in people of African descent who have greater genetic vulnerability. The PSA, prostate-specific antigen blood test, is a valuable tool for screening, associated with a physical examination of the prostate. In suspected cases, biopsies and imaging tests, such as MRI, are used to confirm the diagnosis. When detected early, prostate cancer has high treatment success rates, which may include surgery, radiotherapy, and in some cases, active surveillance. Taking care of men's health involves carrying out periodic exams and seeking medical advice at the slightest warning sign. And while we're talking about diseases that hide, the next cancer on the list disguises itself as more common problems, making it even more insidious. 12. Leukemia, the cancer that disguises itself as common diseases. Leukemia, a type of cancer that affects the blood and bone marrow, is known to manifest silently and with symptoms that can easily be confused with other simpler diseases. This characteristic makes its early diagnosis a major challenge. Early signs include extreme fatigue, frequent fevers, loss of appetite, night sweats, and bone or joint pain. Additionally, recurring infections, unexplained bruising, and excessive bleeding may occur, but these symptoms are often associated with problems such as anemia or viral infections. There are different types of leukemia, the most common being chronic lymphocytic leukemia and acute myeloid leukemia. Each of them has specific characteristics, but all require immediate medical attention if persistent symptoms appear. Risk factors include a history of exposure to radiation or chemical substances, as well as genetic predisposition and certain previous hematological diseases. The diagnosis is made through blood tests such as a complete blood count, which can identify changes in white and red blood cells and platelets. In suspected cases, more advanced tests, such as bone marrow biopsy, are performed. Leukemia can be treated with chemotherapy, radiotherapy, or a bone marrow transplant, depending on the type and stage at which it was diagnosed. Knowing the signs and seeking medical evaluation in the event of any suspicion is essential to starting treatment on time. And now, let's talk about a cancer that literally affects the eyes and can be even more difficult to notice. 13. Ocular melanoma, the villain that lives in your eyes. Ocular melanoma is a rare type of cancer that affects the eyes, often developing silently and without causing obvious symptoms in the early stages. This makes it especially insidious, as in many cases, it is only detected during routine eye exams. Because it is a cancer that originates in pigment-producing cells, it can appear in areas of the eye that are difficult to visualize, such as the uvea, which includes the iris, ciliary body, and choroid. Symptoms, when they appear, may include blurred vision, dark spots on the iris, flashes of light, or a shadowy sensation in peripheral vision. However, these signs often only appear in more advanced stages. Risk factors include prolonged exposure to ultraviolet light, fair skin and light eyes, as well as genetic predisposition. Diagnosis is usually made through detailed ophthalmological examinations, such as ocular ultrasound or optical coherence tomography. Treatment can range from surgical removal of the tumor to radiotherapy, depending on the size and location of the melanoma. Early detection is essential to preserve vision and prevent more serious complications, including the spread of cancer to other parts of the body. Don't underestimate the importance of regular eye exams, as they can reveal serious conditions that would otherwise go unnoticed. And while this cancer affects our eyes, the next one on the list poses a threat to the body's soft tissues. 14. Sarcoma, the silent threat in soft tissue. Sarcoma is a rare type of cancer that can develop in the body's soft tissues, such as muscles, tendons, fat, blood vessels, and nerves. Its silent nature makes early diagnosis a major challenge, as the initial symptoms are subtle and often ignored. One of the first signs may be the appearance of a painless mass or nodule anywhere on the body, usually on the legs, arms, or abdomen. Over time, this lump can increase in size and, in some cases, cause pain or pressure on nearby organs and nerves. Although anyone can develop sarcoma, risk factors include family history, exposure to radiation, and certain genetic conditions, such as Li-Fraumeni syndrome. People who have already been treated with radiotherapy for other types of cancer are also more vulnerable. Diagnosis usually involves imaging tests, such as MRI or CT scans, followed by a biopsy to analyze the tissue. Treatment may include surgery to remove the tumor, chemotherapy or radiotherapy, depending on the location and stage of the disease. Raising awareness about sarcoma is critical, as early detection significantly increases the chances of successful treatment. And as we approach the last item on the list, we'll explore a cancer that defies even the most advanced diagnoses. 15. Brain cancer, the symptoms that can confuse anyone. Brain cancer is one of the most challenging forms of cancer, not only because of its severity, but also because of the difficulty of early detection. Its symptoms can vary widely, often being confused with other neurological problems or even everyday issues such as stress or fatigue. Among the most common signs are persistent headaches, which do not respond to conventional painkillers, nausea, vomiting, and changes in vision. Other symptoms include memory problems, changes in behavior, difficulty speaking or understanding words, and weakness on one side of the body. The location and size of the tumor determine the severity and type of symptoms presented, which makes each case unique and difficult to diagnose. Risk factors include family history, radiation exposure, and certain genetic syndromes such as neurofibromatosis. However, many cases of brain cancer arise without an apparent cause, which reinforces the importance of being aware of persistent and unexplained signs. Diagnosis involves imaging tests, such as magnetic resonance imaging or computed tomography, and, in some cases, biopsies to analyze brain tissue. Treatment may include surgery, radiation therapy, chemotherapy, or a combination of therapies, depending on the type and location of the tumor. Understanding the signs and seeking quick medical evaluation can make all the difference in quality of life and treatment success. Now that we've explored the quieter cancers, let's discuss how to spot the warning signs before it's too late. How to identify alerts before it's too late. Recognizing the early signs of any type of silent cancer is one of the most important steps in improving the chances of diagnosis and successful treatment. Although each type of cancer has its own characteristic symptoms, there are some general signs that should never be ignored. Unexplained weight loss, extreme tiredness, persistent pain in any part of the body, and notable changes in bodily functions, such as urinating, bowel movements, or breathing, may be signs of something more serious. In addition, changes in nodules, patches of skin, unusual bleeding, or any sudden change in health should be investigated. Carrying out regular exams, even in the absence of symptoms, is essential for early detection. Annual checkups can help identify subtle changes before they develop into larger problems. It is also essential to adopt a healthy lifestyle, with a balanced diet, physical exercise, reducing alcohol consumption, and giving up smoking. These simple actions can significantly reduce the risk of developing many types of cancer. Finally, periodic medical monitoring and the search for information are the best ways to protect your health. Never hesitate to seek guidance if something seems wrong, because when it comes to cancer, time is a valuable ally. Now it's time to reflect on everything you've learned and understand how to put this knowledge into practice. Taking care of your health is an act of courage and self-love. Today you learned about 15 types of cancer that may go unnoticed, but now you have the power of knowledge on your side. Understanding the signs, knowing how to prevent it, and seeking medical help at the right time can make all the difference in your life and the lives of those you love. Don't wait for symptoms to get worse or rely on chance. Be proactive, carry out routine exams, adopt healthy habits, and never ignore what your body is trying to tell you. Remember that prevention is always the best path, and early diagnosis is the key to facing any health challenge. You are not alone on this journey. Seek information, trust healthcare professionals, and make informed decisions to care for yourself. Health is the most precious asset we have, and every step in the right direction can save lives.